making dental crowns, we remove a layer from the outer surface, create a little seat, and then fit the crown on. It's like a little hat that you would wear on the tooth to make sure it holds it through and it doesn't let it break anymore, separate anymore. So it gives retention to whatever tooth structure is there. The material used for dental crowns can be metal, can be ceramic, or metal and ceramic, depending on where the tooth is positioned, how much pressure is on it, what your dentist recommends. We are going to go through these materials one by one. In the meantime, while we are making you a crown, we might be making it on the same day if we have all the tools and machines, so you just wait a few hours, or we might need few days for it to be ready. In this case, we are going to prepare a temporary dental crown, put it on the surface of the tooth, glue it on temporarily, and ask you to wait a couple of days, even a couple of weeks. Why do you have a temporary crown if you are gonna get a permanent crown later? First thing first, it can be cosmetic. If it's a front tooth, you don't want your tooth to look shaved or broken. Second, if it's a back tooth, you wanna hold it hygienic. You don't want food and bacteria to get on the surface of naked, cut out, polished tooth. But also it might cause sensitivity. If the tooth's naked and it has lost most of its enamel, you don't want to feel sensitivity. So basically we are covering the tooth to give it protection while we're making you a dental crown. It is still very important for you to floss it, or if your dentist says that it's not flossable, basically it's attached to the next teeth, they will give you a way to clean your gums around. So there are interdental brushes you can use, or water flossers, or even mouthwash. You can't just not floss for the next 1 or 2 weeks and go back to the dentist to get your crown, because your gums can be swollen, red, puffy, bleed, and cause the cementation to fade. There are 3 main types of material used for dental crowns. Which one's better? Which one to choose from? One is full porcelain or ceramic, which is white, tooth colored. Basically, we camouflage it. You cannot tell if it's a tooth or if it's a crown. Second is going to be metal. Now, metals, you have a whole list of them. There can be precious metals or semi-precious metals. Basically, different type of them. And why would somebody pick metal over ceramic? The third type can be acrylic, which is mainly the material we use for a temporary crown. The fourth and last type is going to be porcelain-fused-to-metal. Those are the ones that are a combination of porcelain outside to look pretty, metal inside to give it strength. Nowadays, they are rarely used because they need a lot of tooth structural removal, and it kind of defeats the whole purpose of giving a tooth a crown if we are going to cut the tooth that much. Porcelain or ceramic crowns. Dental ceramic crowns are the most commonly used dental materials for crowns because they're tooth colored and they're strong enough. Back in the days, we used to use a layer of metal, a layer of porcelain on top, which was called Porcelain-Fused-to-Metal or PFM. They're not common anymore and they're not liked anymore because the metal starts showing from underneath, and the ceramic nowadays is so strong that it doesn't need the support from the metal. The only benefit that a dental crown such as gold crown can have over ceramic is that it needs much less tooth preparation, and gold is very flexible. So although you might think that you've seen it in the movies and who would use gold crowns nowadays, they are the best material when it comes for dental crowns. They are flexible, they don't chip and break easily or at all, and they need the minimal tooth preparation. But to be fair, if it was me and I was having a gold crown somewhere that it would show, probably I would also prefer to have ceramic dental crown. Between these 2 common materials to choose from, if you're in between, first of all, get your dentist's opinion on it. It really is important in what position the tooth is and how much pressure is on it. When we say that dental gold is more flexible and it needs less dental reduction, it doesn't mean that ceramic or porcelain is not good or strong enough. They're both very good materials. They're used very commonly and they last usually on average between 10 to 20 years. Beside these 2, we also have PFM, which I already explained, porcelain-fused-to-metal, not used anymore as much because it's not as cosmetic, And if we want it to be strong enough, we can just go with ceramic or just go with metal. We don't need both anymore nowadays. And acrylic, which is the inferior material, it is cheaper to be used, but it will break much faster. So usually acrylic is used as a temporary solution, not permanent. If you have any questions about this video, comment below and I'll get back to you in my next video.